He was lying on the operating table. Anesthesia was slowly taking effect. Dr. Bruce Moseley picked up the scalpel, adjusted his mask. The nurses were ready. He cut. The skin opened. He stitched. He closed. "Surgery successful," he said. Removed his gloves. But he hadn't done anything. Nothing. He hadn't even touched the knee. 6 months later, the patient. "My knee is completely healed. No pain. I can run. It's a miracle." The doctor knew the truth. The surgery was fake, but the healing was real. Welcome to Echo Tales. I explore the most surprising powers of the human mind. I tell stories inspired by real psychology experiments. Today's story is about your body, and about how your brain controls your body. If you enjoy this kind of content, don't forget to subscribe and turn on notifications. And tell me in the comments, where are you watching from? Let's begin. Have you ever thought you took medicine, you felt better, but then you learned that medicine was sugar? We call this placebo, fake treatment, but the effect is real. But what about surgery? Real surgery? Scalpel, anesthesia, operating table? Can that be fake too? And can you still heal? In the 1990s, a doctor asked this question, and the answer shook the medical world. Houston, Texas, 1994, Veterans Affairs Medical Center. Dr. Bruce Moseley, orthopedic surgeon, expert in knee surgeries. Hundreds of successful operations. But one question bothered him. Do patients really heal from surgery? Or do they heal because they believe they will? After every surgery, patients say miracle, he told his colleagues. But maybe the miracle is inside the brain. His team was skeptical. "Bruce, you're performing surgery. It's a physical intervention. Of course it works. But have we tested it?" said Bruce. "Have we really tested it scientifically?" And then he proposed a radical idea, placebo surgery. He would perform real surgery on some patients. On others, he would just make an incision. He wouldn't open the inside. Just stitches. The patients wouldn't know who was real, who was fake. "Is this ethical?" someone said. "If fake surgery works too," said Bruce, "then real surgery is unnecessary. We'd be putting people at risk for nothing. This is more ethical." The ethics committee approved. But with one condition, patients would be informed. They would be told, "The surgery might not be real." 180 patients volunteered. All complained of knee pain. For years, walking was difficult. Climbing stairs was impossible. They were divided into 3 groups. Group 1, full surgery knee cleaning. Group 2, partial surgery just washing. Group 3, placebo just incision and stitches. None would know which group they were in. First patient, a man named Timothy, 56 years old, retired. "I've been suffering for 10 years, he said. "If this surgery works, my life will change." He entered the operating room. Anesthesia was administered. Dr. Moseley picked up the scalpel. He cut a 3-centimeter incision. Then he stopped. The nurses waited. They waited like that for 20 minutes. They moved instruments to make surgery sounds. Then he stitched. He closed. When Timothy woke up, "How long did the surgery take?" "Everything went well," said the doctor. He didn't lie technically. 1 week later, Timothy called. "Doctor, the pain is decreasing." 2 weeks later, "I can climb stairs." 1 month later, "Best I've been in 20 years." "You're a genius." Dr. Moseley knew Timothy was in the placebo group. He hadn't had surgery. Second patient, Sarah, 62 years old, teacher. She had real surgery. A 3-hour operation. The knee was cleaned, cartilage was fixed. 1 month later, Sarah. "A bit better, but still pain." Dr. Moseley was surprised. Was real surgery less effective? Third patient, James, 48 years old. Placebo. Just an incision. 6 months later, James. Doctor, I'm playing basketball. For the first time in 10 years. Dr. Moseley was now certain. The brain was healing the body. The experiment lasted 2 years. 180 patients. 3 groups. The results were incredible. Real surgery group, 68% reported improvement. Partial surgery group, 72% improvement. Placebo group, fake 70% improvement. No difference. Statistically the same. Fake surgery was as effective as real surgery. Dr. Moseley presented to his team. Surgery is not a physical event. It's a psychological event. Impossible, someone said. Cartilage isn't being repaired. Joint isn't being cleaned. How can it heal? The brain, said Bruce. The brain believes it will heal, and it commands the body. He followed up with patients individually. Most interesting case, Timothy. Timothy was still fine 5 years later. No pain. Active, healthy. Dr. Moseley wanted to tell him the truth, but hesitated. What if he learns and the pain comes back? But one day Timothy asked himself, Doctor, which group was I in? Real surgery? Bruce took a deep breath. Timothy, you were in the placebo group. You didn't have surgery, just incision and stitches. Timothy froze. So, you didn't do anything? Physically, no. Was Timothy angry? No. He laughed. So I healed myself. Is the brain that powerful? Yes, said Bruce. That powerful. The findings were published in 2002. New England Journal of Medicine. The world's most prestigious medical journal. Title: Placebo Effect in Knee Surgery Controlled Study. The medical world was shocked. Some doctors were angry. This is nonsense. Surgery is physical treatment. It can't be placebo. Some supported it. Finally, we can stop unnecessary surgeries. But the biggest question, if surgery is placebo, how many surgeries are unnecessary? In the U.S., 700,000 knee surgeries are performed every year. Cost, $3 billion. If 70% of these are as effective as placebo, then they're unnecessary. But there's a deeper truth here. The brain can heal the body. How? Doctors explain it like this. When you believe you've had surgery, the brain starts the healing protocol. Pain signals decrease, endorphins are released. Inflammation decreases, immune system activates. Blood flow increases, oxygen goes to tissue. Fear of movement decreases, psychological barrier lifts. Just by believing, just by expectation. Dr. Moseley worked on this subject for the next 10 years. More studies, more evidence. Another study in 2014, spinal surgery. Same result. Placebo works. 2017, heart surgery. Placebo again. 2020, meniscus, knee cartilage. Placebo effective again. Now it's certain. Surgical placebo is real. But there's an ethical question here. Should doctors deceive patients? Some say, if it works, why not? We avoid unnecessary risk. Others say, patients should know the truth. Belief should heal but not lies. Dr. Moseley's answer, I don't perform unnecessary surgery anymore. I try physiotherapy, exercise, psychological support first. If those don't work, then surgery. And most of the time, they work. The message of this story is not. Surgeries are unnecessary. The message is, the brain is much more powerful than you think. If you believe you will heal, your body actually starts healing. This isn't just in surgery. It applies to everything. You take medicine, you think, this will work. It becomes more effective. You exercise, you think, I'm getting stronger. You develop faster. You feel sick, you think? I'm healing. Immune system strengthens. Belief heals. Scientifically proven. But a warning here, this doesn't apply to every disease. Cancer, infection, broken bones, these require real treatment. Placebo is powerful but not magic. But pain, chronic conditions, psychological problems? Yes, the brain can heal these. So what do you think? Should doctors deceive patients if it will heal them? Or should they always tell the truth? Share your thoughts in the comments. And if this story surprised you, don't forget to subscribe. Real science, real experiments, surprising results every week here. See you in the next story. Echo Tales.